Thank you, Acting Karen Curlan, and thank you, Taoiseach. And Taoiseach, in fairness, we all want to see the reopening of indoor dining and the hospitality in a safe way, and we all want to take the advice from the national public health authorities. We all want to do the right thing here. I spoke yesterday on this, and as I said then, the devil is in the details. I'm really concerned that we are drawing a line between vaccinated and unvaccinated people. I know we are seeing the rapid spread of the Delta variant, and we have to protect those who are not vaccinated from getting COVID-19, but I really am not sure we are doing this the right way. I am concerned about staff in the hospitality, largely young and unvaccinated, because we did not prioritise them. I am concerned about businesses and the information that is not being provided to them. I have received many calls, emails, and people have come to my office with petitions. There are those who are vaccinated who oppose this, who take exception to being asked private health information on an evening out to eat. They are saying that they won't stand for this. And there are those who could not get a vaccine yet for a variety of reasons, and they are concerned here. There are businesses in Carlow and across Ireland afraid to reopen this month until they see how this works, who enforces it, what the public reaction is, and there are staff who are afraid to actually, they're afraid of the negative treatment if they ask about the vaccination to a customer. There are customers who have vowed not to spend in the hospitality because of this. We're planning here to restrict indoor dining to those who are vaccinated and those who have recovered from COVID. However, we are allowing in under 18 years without the possibility of a vaccination. Now, I do not for 1 second advise that we ban them, but this is not making sense when we are not allowing indoor summer camps for children on public health grounds. And that has been an absolute huge issue for me, Taoiseach. The amount of families and women that have rang me so upset over that. I mean, are we putting young people at risk of COVID, of the long COVID with this? I mean, we're allowing one sector to have this and we're not allowing another. We have to be so careful here. The inconsistency here are massive and people have had valid concerns. I've heard from so many people in Carlow, and I have listened to them, and I am caught here. I have concerns about how quickly this legislation is coming in, but I am also concerned about the businesses closed for over a year now. And I also have had lots of meetings with businesses, the hospitality sector that has been closed for so long, and I know that is a huge issue for jobs. So I know we have to be very mindful of that. While this legislation provides a framework to enable to do an assessment of the potential use of the PCR testing and antigen testing, but we are only bringing forward proposals. We don't have enough vaccine to vaccinate the young people in Ireland. Have we even a plan for those under 18s? I feel like there is much too much of a rush, but I want to help those businesses that are suffering. I would insist that this legislation only be for a short period and will end on October the 9th next, and that's the one commitment, Taoiseach, that we need to give today. We are still in the middle of a global pandemic. Just this morning we saw an increase in the hospitalisation with the virus. I'm concerned about how we look abroad on these things, and if you look at Austria, Denmark, Estonia, Bulgaria, Finland, Poland, Spain and Sweden all have these certs, and we see France and Greece moving in the same direction. They are doing it to encourage vaccination. However, the UK in their government's COVID strategy certification review report July 2021 said, while there would be a public health benefit, it was judged that the burden, particularly on those who have not yet been offered a full course of vaccination, would be disproportionate to the public health benefit at this stage of the pandemic. They are not doing it. What are we doing in this regard? And there's so much to lose here with these restrictions, and we have huge number of infections. We have to tread carefully here and listen to that side of the argument. And I think, Taoiseach, we do need to listen to every side here. There have been huge concerns. We have said we would not make mandatory vaccination a rule, and yet we are asking Irish people to get vaccinated, for they cannot participate fully in the reopening of our society, and that, Taoiseach, is not right. I spoke yesterday about one single issue, the toilets. Those people unvaccinated sitting outside can currently use facilities inside a restaurant. So will they still be allowed to do that when we allow vaccinated diners inside? And how does that make sense? The Delta variant is faster to transmit, so a few minutes in a public bathroom could be a dangerous situation for an unvaccinated person, but also could put staff at risk. Our business to segregate toilets, who will police this mixing? If there is an outbreak, what is the liability for businesses who have done everything right? There are legitimate concerns coming from businesses about how this will work and if it will backfire on them and their staff, of course. And there are too many questions, and there is a lot of discomfort here, Taoiseach. I would like to see us emphasise more on vaccination, those who can and want a vaccine regardless of age, and I think we should open the portal to under 18s. And then I reckon we will see a massive, I think, surge in the vaccine uptake. We have, look, people have been so good, and I just want to compliment the people of Ireland, Taoiseach. The vaccination uptake has been absolutely brilliant, and we need to work with the people as we're doing, and I think it's important now. Look, our summer is coming, and I know hospitality is so important, like all jobs and across all sectors, so we have to be very careful. But I mean, are we doing enough? The communication, I feel, is not right, and I feel there's such confusion here. And there's even an example. I was speaking to a person this morning, and he can't get the vaccination because of medical issues. So now we're told, okay, you can get a letter from the doctor. Has he to pay for that letter? Has he actually to ring his doctor and look for a medical letter? Will he have to pay for that? And look, that's unacceptable if people have to go to their doctors and get a letter and they have to pay for it. So we have to be very careful how we do this. What way will the HSE work on it? Will they give out letters? And I mean, there is genuine concerns for people that don't want to get the vaccine, and we have to be very mindful of them, Taoiseach. We can't have a two-tier society, and I would ask that you would look at this. I would ask that we don't rush it, but I would ask, look, we have to really say well done to everyone. We have to compliment everyone, because COVID has been so hard with the loss of lives. And I know that we have to put people's lives first. And that's one thing as a government I feel we could be really proud of. But when we move on, we have to make sure that it's an Ireland for all and everyone is inclusive. And I would ask you, Taoiseach, that you would do that. Thank you very much.